Hey class, today we're going to talk about a big topic that affects millions of girls worldwide, female genital circumcision, also known as female genital mutilation.
What is female genital circumcision? Female genital circumcision is described as a traditional practice in which the external female genitalia is partially or totally cut off for a non-therapeutic reason. This type of circumcision is common in Africa with varying prevalence in different countries and is often performed with the aim of fulfilling religious or cultural rites and sometimes economic benefits.
Today we'll be looking at female circumcision in the lens of the ecological theory. This theory is concerned with the many social and cultural contexts that impact and influence our sexual lives, which can range from immediate influences or the individual like school, religious institutions, and neighborhoods, to broader contexts such as government, educational, and political systems. When it comes to female circumcision, multiple cultural and social forces keep the practice alive.
In medical literature, there are 4 types of female circumcision.
Alright, so this is our representation of a vagina, since Dr. Lauren would not allow us to show a real one. And we're going to go through the 4 different types of female circumcision. Right here we have our labia majora, our labia minora, and a representation of the clitoris. So, type 1 involves excision of the clitoral hood with or without removal of parts or the entire clitoris. So we're just going to take him right out. Type 2 involves excision of the clitoris together with parts or all of the labia minora. Type 3 involves excision of parts or the whole of the clitoris, labia minora, and labia majora, and stitching or narrowing of the introitus with a very small outlet for passage of urine and menstruum. This is known as infibulation. Oh yeah. Get rid of that labia majora. Type 4 involves other harmful procedures to the female genitalia for non-medical purposes, including pricking, piercing, incising, scraping, and cauterization.
Razor blades, sharpened kitchen knives, scissors, glass, sharpened rocks, and fingernails are common tools for female circumcision.
Ooh, where did female circumcision start? Well, no one's really too sure. Historians seem to highlight Egypt as a practice's origin. Don't be fooled, however, this practice is well documented outside of Africa, including in ancient Roman and Russian populations.
Today, female circumcision is mostly isolated to a band of nations within the African continent. Prevalence of the practice ranges from as low as 5% of women affected in Niger to 99% of women affected in Guinea.
Every year, 3 million African and Middle Eastern girls and women undergo circumcision. Approximately 130 million living girls and women have undergone circumcision, and 63 million more are expected to be affected by 2050. Women from all religious groups are affected, including Christianity, Islam, and traditional worship. Female circumcision affects varying age groups, from the first week of life, during infancy, before puberty, before the first childbirth, and other significant periods to the culture.
Unfortunately, female circumcision comes with consequences. Immediate complications include excruciating pain, hemorrhage, shock, acute urinary retention, and an injury to adjacent tissues. Long-term complications create a more grim outlook. Complications range from infection, infertility, cyst and abscess growth, loss of sexual sensation, and obstructed labor.
Physical consequences aren't the only impact of female circumcision. The psychological effects of circumcision depend on the type of procedure performed, experience of the circumciser, and the social atmosphere at the time of the cutting is performed. PTSD, anxiety disorders, panic disorders, inhibition, depression, and suicide are potential effects due to psychological trauma of the painful procedure. Sense of humiliation and being betrayed by parents, use of physical force by those performing the procedure, a negative general image, and lack of sense of ownership of their bodies. These effects can be amplified by resulting loss of sexual pleasure or infertility.
On the contrary, circumcision may provide relief to someone who is made to believe and celebrate the cultural act in the community where female genitals are seen as dirty or a source of enthralling temptation.
So, why is female circumcision so important to these African cultures? In most communities, circumcision is considered a marker for the girl entering the next phase of her life. This marker is reinforced by communal ideas concerning purity, cleanliness, economic achievement, and aesthetic.
Those who've been circumcised are often perceived to be at a higher status than those who are not, as bride prices for circumcised women are far higher than prices for uncut women. Additionally, it's used to improve marriage prospects of young girls through the reduction of promiscuity and insurance of virginity. In Somalia, a husband's family has the right to inspect a bride's body prior to marriage, and women accused of sexual sin may expose her genitals to prove herself chaste. Circumcision may be even required to get married at all, and it may be a prerequisite for the right to inheritance.
The need for female circumcision in these nations are reinforced by attitudes among leaders and community ideals. Religion plays a large part in its reinforcement, as many incorrectly believe that female circumcision is a requirement of Islamic faith. Individuals within the community also impact the need. The attitude of the family leaders, such as husbands and fathers, is important in eradicating the practice, in addition to individuals who isolate and stigmatize those who remain uncut. Even former exercisers and midwives campaigning against female circumcision still attribute purity and cleanliness to excised women, but impurity to uncut women, displaying how ingrained these values are. Cutting also has value widely assumed to depend on whether families expect uncut wives for their son. Community expectations create a peer pressure to circumcise.
So, what's being done about female circumcision? Western efforts to halt female circumcision trace back to the 1920s when colonist women and missionaries spoke against the practice. The first anti-circumcision programs focused on detrimental health effects, but this approach proved to be ineffective, as the cultural significance of the practice surpasses any physical complications. Today, the most successful efforts to take down female circumcision involve increasing women's education and empowerment, socioeconomic development of affected communities, and community involvement in identifying problems and solutions concerning the practice.
Since 1995, 24 states in the U.S. have created anti-female circumcision laws, including forbidding the practice being performed on minors and criminalizing transportation of children outside the U.S. for the purpose of female circumcision. Non-governmental organizations have been in the forefront of this fight, including UNICEF, WHO, and the Inter-African Committee on Traditional Practices Affecting the Health of Women and Children.
What options do affected women have? The best management is always to prevent the occurrence of female circumcision. But when it has occurred, the line of management is responding to patient-specific complications. Western healthcare facilities should be prepared to treat women who have been circumcised, as women feel relieved when healthcare providers have experience with female circumcision and could provide appropriate care.
For more support and information concerning female circumcision, please visit equalitynow.org for help.